Q1. How do you value dignity respect in nursing care? Select which does not apply. We value every patient, their families, or carers, or staff. We respect their aspirations and commitments in life, and seek to understand their priorities, needs, abilities and limits. We find time for patients, their families, and carers, as well as those we work with. We are honest and open about our point of view and what we can and cannot do. Q2. What are the key reasons for administering medications to patients? To provide relief from specific symptoms, for example pain, and managing side effects as well as therapeutic purposes. As part of the process of diagnosing their illness, to prevent an illness, disease, or side effect, to offer relief from symptoms or to treat a disease. As part of the treatment of long-term diseases, for example heart failure, and the prevention of diseases such as asthma. To treat acute illness, for example antibiotic therapy for a chest infection, and side effects such as nausea. Q3. You are transcribing medications from prescription chart to a discharge letter. Before sending this letter, what action must be taken? A registrant should sign this letter. Transcribing is not allowed in any circumstances. The letter has to be checked by a nurse in charge. Letter can be sent directly to the patient after transcribing. Q4. Which statement is not correct about the nursing process? An organized, systematic and deliberate approach to nursing with the aim of improving standards in nursing care. It uses a systematic, holistic, problem-solving approach in partnership with the patient and their family. It is a form of documentation. It requires collection of objective data. Q5. All individuals providing nursing care must be competent at which of the following procedures? Hand hygiene and aseptic technique. Aseptic technique only. Hand hygiene, use of protective equipment, and disposal of waste. Disposal of waste and use of protective equipment. All of the above. Q6. A nurse explains to a student that the nursing process is a dynamic process. Which of the following actions by the nurse best demonstrates this concept during the work shift? Nurse and client agree upon healthcare goals for the client. Nurse reviews the client's history on the medical record. Nurse explains to the client the purpose of each administered medication. Nurse rapidly reset priorities for client care based on a change in the client's condition. Q7. Hospital discharge planning for a patient should start when the patient is medically fit. On the admission assessment. When transport is available. Please like and subscribe. Q8. The client reports nausea and constipation. Which of the following would be the priority nursing action? Collect a stool sample. Complete an abdominal assessment. Administer an anti-nausea medication. Notify the physician. Q9. Which of the following sets of needs should be included in your service user's person-centered care plan? Social, spiritual and academic needs. Medical, psychological and financial needs. Physical, medical, social, psychological and spiritual needs. A and B only. All of the above. Q10. Patient bring own medication to hospital and wants to self-administer. What is your role? Allow him. Give medications back to relatives to take back. Keep it in locker, use from medication trolley. Explain to patient about medication before he administer it. Q11. What are the potential benefits of self-administration of medicines by patients? Nurses have more time for other aspects of patient care and it therefore reduces length of stay. It gives patients more control and allows them to take the medications on time, as well as giving them the opportunity to address any concerns with their medication before they are discharged home. Reduces the risk of medication errors, because patients are in charge of their own medication. Creates more space in the treatment room, so there are fewer medication errors. Q12. Which of the following people is not exempted from paying a prescribed medication? Children under the age of 16. Women of childbearing age. People who are receiving support allowance. Pensioners of age 65 and above. Q13. What medications would most likely increase the risk for fall? Loop diuretic. Hypnotics. Beta blockers. NSAIDs. Q14. A client experiences an episode of pulmonary edema because the nurse forgot to administer the morning dose of furosemide, Lasix. Which legal element can the nurse be charged with? Assault. Slander. Negligence. Tort. Q15. Which of the following is not a part of the 6 rights of medication administration? Right time. Right route. Right medication. Right reason. Please like and subscribe. Q16. Registrants must only supply and administer medicinal products in accordance with one or more of the following processes, except Carer-Specific Direction, CSD. Patient Medicines Administration Chart may be called Medicines Administration Record MAR. Patient Group Direction, PGD. Medicines Act Exemption. Q17. On checking the stock balance in the Controlled Drug Record Book as a newly qualified nurse, you and a colleague notice a discrepancy. What would you do? Check the cupboard, record book, and order book. If the missing drugs aren't found, contact pharmacy to resolve the issue. You will also complete an incident form. Document the discrepancy on an incident form and contact the senior pharmacist on duty. Check the cupboard, record book, and order book. If the missing drugs aren't found, the police need to be informed. Check the cupboard, record book, and order book and inform the registered nurse or person in charge of the clinical area. If the missing drugs are not found, then inform the most senior nurse on duty. You will also complete an incident form. Q18. A walk-in client enters into the clinic with a chief complaint of abdominal pain and diarrhea. The nurse takes the client's vital sign hereafter. What phase of nursing process is being implemented here by the nurse? Assessment. Diagnosis. Planning. Implementation. Q19. Nursing care should be task-oriented. Caring medical and surgical patient. Patient-oriented, individualistic care. All of the above. Q20. The nurses on the day shift report that the controlled drug count is incorrect. What is the most appropriate nursing action? Report the discrepancy to the nurse manager and pharmacy immediately. Report the incident to the local board of nursing. Inform a doctor. Report the incident to the NMC. Q21. When do you see problems or potential problems? Assessment, planning, implementation, evaluation. Q22. How the nurse assesses the quality of care given reflective process. Clinical benchmarking. Peer and patient response. All the above. Q23. A newly admitted client refusing to hand over his own medications, and this includes controlled drugs. What is your action? You have to take it anyway and document it. Call the doctor and inform about the situation. Document this refusal as these medications are his property and should not do anything without his consent. Refuse the admission as this is against the policy. Q24. The rehabilitation nurse wishes to make the following entry into a client's plan of care. Client will re-establish a pattern of daily bowel movements without straining within 2 months. The nurse would write this statement under which section of the plan of care? Long-term goals. Short-term goals. Nursing orders. Nursing diagnosis problem list. Please like and subscribe.